right, hello and welcome to tonight's program. Thanks for joining us, everybody. My name is Aaron Rosenblum. I'm the Health and Science Librarian at the Portland Public Library, and I will be your host this evening. If you have any questions or issues connecting, you can communicate with me in the chat. You can see that the user for me is Portland Public Library. So feel free to get in touch that way using the chat feature. Tonight's event is on COVID's front lines, Maine's healthcare workers in their own words, an exploration of the pandemic through the experiences of our panel of Southern Maine health professionals. The panel discussion will be followed by a Q&A, and for that, you can use the Q&A feature or the chat feature in your Zoom, and we'll see them either way, and we'll collect those up, and we will answer them at the end. The Q&A will be at the end of the session. And before I introduce the panel, I would like to just quickly point you to portlandlibrary.com, where you can find out about our future events and, of course, about our collections and services and our latest hours and sort of COVID updates and as we move back towards eventually our full services. And of course, you can like and follow the PPL Facebook page, another great way to find out about what's going on at the library. So I will let you know who's going to be talking this evening. With first, the moderator, Dan Koeppel, is the co-author with Dr. Robert Mayer of the forthcoming Every Minute is a Day, a Doctor, an Emergency Room, and a City Under Siege, which is about the pandemic in New York in one emergency room. Koeppel received a James Beard Award for his book Banana, The Fate of the Fruit That Changed the World, and the London Independent called his first book, To See Every Bird on Earth, A Father, a Son, and a Lifelong Obsession, quote, a tender, beautifully written account by an outstanding nature writer, unquote. Munib Abid is pursuing a Bachelor's of Science in Nursing and Health Sciences from the University of New England. In late 2020, he was part of a group of UNE nursing students that spent 5 weeks assisting at the Island Nursing Home on Deer Isle after COVID spread among the nursing home's regular staff. We also have Dr. Joanna Fox. Dr. Fox has been practicing general dentistry in Southern Maine since 2013 and established Fox Family Dental in South Portland in 2018. She holds a BS from the University of New Brunswick, Fredericton, and a DMD from Tufts University. And we have Jason C. Libby. Jason C. Libby is a certified adult and hospice and palliative care nurse practitioner. He is the NP supervisor at the Hospice of Southern Maine, where he has practiced since 2010 and works with both the home program and the Gosnell Memorial House patients. So that's all I really have to say and introduce, and I'm really looking forward to this conversation, as I hope you are. So I'm delighted to hand things over to Dan.
Thank you so much, Aaron. And I want to say thank you again to you, to the Portland Public Library, to the guests, and to the attendees for allowing this to happen. And I wanted to say a special thank you to Jason, Munib, and Joanna, for their service during the pandemic. I didn't do much, so you guys all put yourselves at greater risk. I'll tell you briefly the story of my book. Dr. Robert Mayer is my cousin. We're very close. He runs the emergency room at Montefiore Hospital in the Bronx, New York. Montefiore probably saw more deaths than any other hospital in the United States in those first few weeks of COVID, starting in March and April. And that's what the book covers. It looks at why that happened, how it happened, and especially about the process of grieving and loss, and how we lost the sense of grieving and loss in COVID, in the deluge. So I was down there in March, all gowned up, and saw things that a guy whose last book was about bananas had never seen or hoped to see or wanted to see. And I gained I can't say I gained a new respect for medical professionals. My dad was an emergency room doctor. I come from family of doctors and used car dealers, as we mentioned before. But what I did gain was a new understanding of how difficult it is to continue providing care during a time when care itself can be deadly and confusing, and when success is not always guaranteed. So I thought we could start, and maybe we'll start with you, Munib. maybe you could just tell us a little bit about yourself and about your experience with COVID, what you did and what you saw, and we'll go to each person and then ask some follow-up questions.
Yep. So I was originally in pharmacy school. I was in nursing program, so I did 2 years of undergraduate work, 2 years of graduate work, and then mid-stride I switched into the accelerated nursing program at around the same time when the pandemic began. When the pandemic began, it kind of made me reflect on a little more on who I am and what I'm doing. I just felt as though direct patient care was something that was more oriented with who I am as a person. And the fact that I speak 2 languages and I'm multicultural and understand a little bit more from the minority perspective as well, I felt as though I could help out a little more to those that need my help. So when I got the email in December from my school, I just finished my winter semester of in an accelerated nursing program. I got an email to go and help out a nursing home in Deer Isle, which was hit hard by COVID. They were working really closely with the CDC, and they didn't have much staffing to help out. I didn't have any nursing experience or any nursing assistant experience. The only experience that I had was kind of more of the medication knowledge. So I kind of went in there blindly and not knowing what to do or what to expect. I thought they were going to orient me. I requested to see if I can have another friend of mine that had 4 years of CNA experience to come and help out. And thankfully he did, because when I went in, I didn't have any orientation. I was just thrown in. I didn't know where anything was. I didn't even know where the closet was. I didn't know the routine. I didn't know what a day looked like. And there was PPE involved. And none of the workers there were pretty much staff workers. A lot of them were travelers as well. So when I went in, I didn't know what to expect. And when I stepped into the room, I saw a lot of these patients' faces. I really felt bad because they didn't have people coming to visit them. A lot of them weren't eating because they weren't in the mood for it. They didn't enjoy. I could tell that they were really depressed. So that nutrition aspect was affecting their overall health as well. They were very understaffed because, like I said, majority of their staff members had COVID, so a lot of them were not there. And personally, during my time there, 62 of the residents got COVID, 15 of them passed away. Four of those 15 were people of my own that I was taking care of. And that was quite eye-opening for myself. I'm glad for the experience that I got during that time, because it kind of reminded me of why I'm doing what I'm doing. And it was just overall great experience.
Thank you, Munib. We will get back to you with more questions. I'm going to go clockwise on my screen, so we'll go to Joanna. Joanna, dentists were in a unique position during COVID. You guys get close to the infection every single day. I know my dentist here in Portland couldn't get masks or PPE early on and had to close down for a while. How did COVID appear on the dental radar, and how did you cope with it?
Yeah, so I mean, definitely we did have access issues, and that has a lot to do with the fragmentation that we experience regularly from the healthcare issue. But initially, we thought we were being shut down for a couple of weeks, and that obviously grew exponentially. We are lucky that we were screening people extensively to not deal with direct COVID patients. And a lot of what dentists do to begin with is extreme in terms of infection control. I mean, if you walk into your primary care physician's office and then you walk into a dentist's office, you're going to see completely different levels of sanitation. And that's because of what we do. It's so important to be experts to begin with in infection control. So we did have to up a lot of our game, but most of it really stayed the same. It was a matter of being allowed to practice again, and then accessing the PPE was nearly impossible, especially for smaller practices. And then we also, in the very small world of dentistry, had a little bit of a battle going on between dentists and hygienists as well. A lot of hygienists felt it wasn't safe to go back when dentists did. And so there was a lot of shift and change in the dental world. A lot of hygienists retired. A lot of dentists retired, and there is already an access to care issue in Maine. So you can imagine that we are seeing a lot of people who have a lot of dental issues, and we're still not anywhere close to being caught up from last year's shutdown. We were closed for a full 3 months. And so that, promoted a lot of infection that would have been taken care of during that time and has just extended. Not to mention the additional behavior habits. People are clenching and grinding their teeth, and people are snacking and sipping like crazy. So, I am so glad to be back at work, and I'm so happy to say that we haven't had to shut down at all. We've had no instances of our staff becoming ill or any of our patients. We've been screening so extensively that we were pretty much able to return to work, but just with extensive levels of screening and PPE. So it just takes us a lot longer to do what we need, thereby adding to the access to care issues. So, it's a little bit different, but we're adapting, and we're just so glad to be able to be back at work and seeing so many more vaccinated patients now. So that's just really, really nice to see.
Jason, I saved you for last because I think, I can't get my head around what you must have experienced. I'd like you to describe your job a little bit, but to most people, hospice care means end of life care, and it means providing dignity to people during that time. And COVID must have certainly, to put it mildly, disrupted that. Tell us a little more about your experience.
Yeah, it really did, and it's I sit here and listen to Munib and Dr. Fox, and I kind of feel bad in some ways because my own self was physically shielded from a lot of patient interaction right from the get-go. So sometime in mid-March, when I think we all started to realize, like, this is going down, this is for real, and I won't ever personally forget that feeling like I was scuttling out of the Gosnell house with a set of monitors and a docking station and my laptop in my arms, because my boss told me I needed to get out of the building. And for the time being, we weren't coming back. A little bit of an explainer. So I'm a nurse practitioner. I work day in and day out at the Gosnell Memorial Hospice House in Scarborough. This is an inpatient hospice facility. We are 18 beds. It's not a nursing home, it's not assisting living, it's basically, think of it, hospital level care for patients at end of life or with a lot of symptom management issues and life limiting disease. And so I physically see patients every day there, but also we have a very large census of patients at home, and that's actually where most hospice patients reside. So, speaking to the inpatient side, we're a small team, and we're the only people who do what we do. And so our board of directors, our CEO, was very concerned about us as providers all of a sudden being incapacitated and not able to do our jobs. The physical plant itself, the hospice facility itself, if we had an outbreak within that, amongst patients, amongst family, amongst our staff, that the entire place was going to be shut down for weeks, if not longer. And that is an interruption into care that we just could not, we just couldn't tolerate that. We're the only providers of that inpatient care. So we had to adapt really fast to continue doing what we were doing. And I have to, give credit where credit is due. The Hospice of Southern Maine pivoted to remote work literally within a weekend. I went home on a Friday. We had never done remote patient visits with the nursing staff, either inpatient or outpatient, although we had talked about it coming down the pike for some of our home program stuff. We weren't anywhere. This was aspirational. This was nowhere near operational. And we had to, as an organization, figure it out in 48 hours because we can't stop. It was a real shock to me. I'm so used to being able to see my patients, and so much of what I do is nonverbal communication, both receiving and sort of broadcasting. I think about it sometimes still. I'm very hard of hearing, and I have to read lips most of the time. And this has been impossible, the past year has been impossible for me visiting with family or visiting, our patients haven't had to be masked, but the family members have been, and it's been really difficult to get a sense of how they're feeling so that I can adjust my approach, so I can really be present and be empathetic in the way they need me. We were very lucky that the hospital systems in the area were able to help us be sure as much as we could that we were not transferring COVID positive patients into the Gosnell house, because the community recognized what a risk that would be for us. But our nurses, didn't have that luxury. They were still going into the homes with patients who were being discharged from the hospital who may be COVID positive. I think it's really interesting to point out, though, that we had very few deaths directly related to COVID on our services. And I don't know why that is exactly. We were all pretty much prepared for the worst. I think there are some positives, though, too, Dan, that I've learned from this transition to some more remote work. I think I probably should have known that we have a generation of grandparents who are used to seeing their grandkids and family members on Zoom or FaceTime. And I was really terrified that I would lose this link. And it is not the same as sitting on somebody's couch in their home with them, talking to them. But I was absolutely wrong that older people who are predominantly who I treat, I was absolutely wrong that they wouldn't be able to adapt to this as well. So there have been some upshots, and it has changed permanently some things that we'll do going forward. And I think a positive way. It's allowed me to be in more places with more people than I normally would be able to. But it's been really hard to have that separation. Like I can't touch people anymore. So, and you have to be very careful about using, therapeutic, connection with people. You don't want to overstep any lines, but it's so often that I can just touch somebody's arm, and it gives them a sense that I'm there with them. I'm sitting with them. I'm really present. And you can't do that. You can't shake somebody's hands. You can't see how they're reacting to what you tell them. And that has impacted our ability to do what we do a lot.
Okay, thank you, Jason. Munib, I'm curious about, you are just at the beginning of your career and you were thrown into this inferno, trial by fire. I guess one of my questions is, obviously you're going into healthcare. You understand that you will be dealing with healing, but also with death. But you saw 4 of your own patients pass very quickly, and how did that affect you? How did you cope with that emotionally?
For me, when I went in there, I already went in with the expectation of what to expect. I went in thankfully with another friend of mine that I'd known since middle school. He's been kind of like my right-hand man, and he helped me kind of understand what to expect and to kind of cope with that in a way. But when I was there, despite me putting in like 8 to 12 hours a day, I still managed to go to the gym and, keep my mental health sane. And that was just the healthy aspects of my overall wellness that I maintained. That's just how I cope with stress in general. Go to the gym, eat healthy foods. And that's just how I cope with it. To me, it was just a natural process of what is expected. And it was eye-opening to me because it also showed me how short life truly is. And with whatever I do, I don't want to regret it down the road in life and tell myself, I wish I did, because there was, in some situations, regret in some people's voices, some situations, just the sadness and all the other things as well. I will never forget those patients' faces. It'll always stick with me. I remember a lot of their names. And yeah, it's just the way I cope with it is just how I usually cope with any form of stress, taking care of my mental health, because if I don't take care of myself, I can't take care of anybody else.
Okay, I'd like to pose that question to Jason and Joanna as well. How did you guys cope with the stress, with the fear, with whatever emotions that came up that might not have normally come up in your everyday practice?
I definitely did find some reprieve in yoga and breathing. I mean, those types of things, because my natural reaction was just to work as much as I could, which you get to a point where that's going to become a problem as well. So I think for me, trying to take time for myself, like you were saying, and get the meditation, the yoga, and the extra breaths in. And then I mean, the biggest fear for me was spreading the virus, and still is. So I think once everyone was vaccinated in my office, that also made me feel a little bit more confident that we were doing our best to not spread things. And I think what we can all do as healthcare providers is exactly as you said, is making sure that we take care of ourselves, because there's so many of us who get into that mode of tough it out. And unfortunately, you really can't care for others when you're in that fight or flight mode yourself. So you really got to get yourself into a place of calmness for your patients.
How about you, Jason?
So this is, I think, this whole experience, I've really been fortunate in my work. I've been over a decade in a field that absolutely requires you to take care of your own mental health, is exquisitely supportive of people who are struggling, with their own emotions around death and dying. Today, I saw 6 people who in the morning who were alive, and by now they've died. And these are some people that I've known, some of them for months now. So that part of it's very natural to me, sort of the management of that loss. And like anybody else, we have we have the things that we do personally to try and maintain your own health. And again, that's sort of ingrained in part of this work, because you can't do what I do day in and day out if you don't have that healthy separation, I think, a little bit from it. And it's I really appreciate what Munib was saying about, this just sense of what is going on, this, just really, like I said, thrown into the fire. To some extent, I don't think that I'm numb to that so much as I have just, we have well-established coping skills with it. I think what was really hard for me, though, that we had to change was not having the families in with the patients as much as they would want to be. It's been gradated. We started with really only being able to have one person, and they had to be gowned from head to toe and masked, because we were, as we've learned, we've been able to do better. But a huge part of what makes a good death, I hate to use that term, but a good death is having your people around you, whether it's family, your friends, whomever that might be. And seeing people dying alone, when everything that I have been doing for 12 years has been trying to get people in a room together when they want to, when they can, to be a part of that, that is hard. It's really hard to see somebody die alone. And that hit me in a way that I didn't expect. When we do have patients who don't have family naturally, or don't have friends, they've chosen not to, that always that hurts in a way that's just very different to me. And I often find myself sitting in a room with somebody who's got nobody. I'll bring my computer in and I'll work out of that room with somebody as they're dying, just so they're not alone, and that happened so much more often than we would ever tolerate during this. And that was hard. That was really hard to see. And, you sometimes you just, you cry and, you feel it. But again, I'm fortunate that this is what I do. It draws a certain kind of person, and also a lot of support from our employer as well to talk about it, to be present with it. We discuss all of this as a group every week as well. So we were lucky in that regard.
Thank you so much, Jason, for that. Joanna, I'm going to go to you with this question. I'm going to just step into my own story a bit and frame the question that way. I was working on the book and going down to New York, and I began having some symptoms of another medical issue. We talked a lot about delayed care, about the inability to access care. And by the time I saw a doctor about it, it was about June of last year, I had a case of stage 3 bladder cancer, and ended up spending the summer on chemo and was not able to get into the biopsy surgery or the chemo as quickly as I wanted. Now I'm fine now. I had multiple surgeries and I'm doing okay. But I got very curious about delayed care. And Joanna, you touched on that. But tell me what kinds of things you did and are doing now to sort of keep from falling behind, and also how you're attempting to catch up now with all these patients who, you know, spend months without seeing a dentist or accessing any kind of medical care.
Yeah, so when we were actually closed down, we were only allowed to do very, extreme emergencies like extractions or root canals. And I'm so lucky to have a great group of specialists in the area who did have access to the PPE that was necessary. So our patients who did, who were a 10 out of 10 on the pain scale could access that type of care. However, the people who were approaching that could not get the care in time. And so, I'm a very small practice. And so we're just extending our hours. We were open 4 days a week. We're now open 5 days a week. We're doing everything we can to see as many patients, but, I hired another dentist. I've really just grown way faster than I would ever have liked to in an attempt to try to catch up. I do want to say though, hearing these different, healthcare providers experience with COVID, we were all terrified, but we certainly didn't have to deal with seeing patients who are ill. And so it's so much respect to you who are able to handle that on a daily basis. I can sometimes get really bummed out about a severe case of periodontitis. And so I'm really not the type to be dealing with folks passing away on a regular basis, but thank goodness there are folks like you who, are more built for that type of thing. But just in general, I've also hired assistants with expanded functions so that I can have more patients receiving care.
Thank you. I want to get a little bit more personal with you guys, and then maybe after that, I'll open it up, and if you guys want to ask some questions of each other, or I have a long list, I can keep going. But we're talking quite a bit about how we perform our jobs as an information provider in my case, or healthcare providers in your case. But personally, how did you experience COVID? Did you have loved ones who got it? Were you able to maintain a separation between work and what you were experiencing at home? How did COVID personally affect you guys? And anyone can start.
I'll start just because I think mine's pretty easy and probably not real atypical. My wife is also a nurse, and she probably wouldn't want me to mention where she's at, but her facility where she was at went through several outbreaks that tore through the residents and the staff. We worried about that because, we're worried about our own personal health and safety. She wasn't going to stop working. I didn't want her to stop working. If she didn't want to, I would have supported it if she had been scared of it. But she was fortunate that she felt like she had the PPE necessary. But this was every single day that she worked, she'd come home 5 more positive, 10 more positive, just get bigger and bigger each time. And then, it'd burn through that section, and then it would be another. And there was a lot of frustration on her part because there were things that could have been done externally to where she works that would have really cut down on this significantly. But you asked personal, we were personally worried. I was worried about her. We're youngish, healthy, but we all know that doesn't really mean much if your number is up with COVID. There was no way of predicting who those young healthy persons were that were going to get infected and those who wouldn't. So we worried about that a lot. My parents, we worried about them, their mental health, because they were separated from their grandkids, and my kids mean everything to them, and they live 5 miles away. And my mom in particular really struggled, and you could tell that it was kind of coming to a point just at the time the vaccinations came out, and she was one of the first in the state vaccinated. She's a healthcare provider as well, and they were vaccinated early, and that saved them, a lot, and that saved us personally too by worrying about my parents. So that's more of my personal experience. I think at work within hospice, I'm looked to as a sort of an information source, a trusted source of information. And I felt really terrible. I'm trying to stay up to date. I'm trying to learn. I'm trying to be educated. And especially in the early days of this, there were so many unknowns. And, my job is to try to make the unknown and the scary, a little less scary and a little more known. And I really couldn't do that within the context of either my family or my coworkers. And so for me personally, that was hard because that's kind of my role, and not being able to do it, it hurt. You wanted to be able to do better, and it just wasn't there.
How about you, Munib? How did you experience the sort of personal side of COVID away from work?
So I am in a household of probably 9, 10. I don't even know. It's too much to count. But so in my household, there's my grandmother, there's my mom, there's my dad. My dad has had multiple corneal transplant surgeries in one eye. He's got a lot of complications. And there's my siblings. But I personally never got it. I don't think. I haven't tested frequently. But I do know of a few people and family members in California that have passed away, and one here in particular that actually passed away. One of my dad's closest friends who'd come every single weekend to our house to have dinner every weekend. And it was sad because my dad doesn't really he had a lot of friends that used to come, but a lot of his other friends got illnesses. One got a stroke, so he wasn't able to come like the weekends that he would. And this other guy was kind of his other right-hand man, and he would have a good time whenever he'd come. And unfortunately, he passed away. With him in particular, I feel bad even more because of the fact that not only was there a healthcare shortage, but he also didn't speak English. So that's another complication that really hits home for me that I really want to help out with, is using that second language ability to help those people and give the care that they need. Because I understand the cultural aspect, I understand what he's looking for. And so seeing that really, it was sad because, like I said, seeing the face of my parents, and particularly my dad, having to deal with that was it's quite sad.
Thank you. How about you, Joanna?
I haven't dealt with anyone passing from COVID. The biggest thing for me has been that I grew up in Canada, and so obviously that border has been closed. I was supposed to get married last year, and that didn't happen because the border closure, we didn't want to have a wedding with half the people there. And so we were hoping we'd be able to reschedule that for this year, but obviously the border is still not open. So, and just, on another kind of personal note, my mom unfortunately is not well. And so right now would be a very important time to go up and visit with her. She's just has been moved to a nursing home. She has early onset dementia. She's had it for almost 12 years now. So she's near the end stages. The time that we would all like to be up with my dad, being there for him during that transition, and we've been kept apart. So certainly we're hoping that changes sometime soon, but for now we're just waiting.
Well, sorry about your mom, and that's something that all of us have experienced to some extent, is this inability to reach out to the people we love, even necessarily by Zoom. And Munib and Joanna, you both brought up something that was on my list of questions. Munib, you mentioned that you speak another language. Joanna, you're from Canada. So, my question is about access to care. And obviously in Canada, this health system is different. Munib, in communities where English is not a first language, access to care can be difficult. Tell me a little bit about what you saw in terms of people being able to get the care they needed, and whether any lessons have been learned. Maybe it's early in your career to be thinking about the healthcare system, but I'd love to hear what all of you guys think about how we can do a better job of getting people the medical care they need all the time and during the next pandemic.
With regards to care, Maine does do a great job with providing care to those that do need it. But unfortunately, some of the people don't realize the resources that are available, so they don't use it. And they also, sometimes depending on culture, will not reach out for help when needed. If they need a ride, for example, because some of them may not know how to drive, they may not know the language, they may not know the area. So that also in turn can delay care, which can make it even worse. And some of them just have a high pain tolerance, and they just decide to not reach out for pain because they think psychologically they can handle it. There's a lot of different factors. And then when it comes to the actual workforce in the state of Maine, unfortunately, some of them have a tough time with relating to the patient, or maybe there are medication errors because of improper translations, incorrect translations sometimes. These are the things that sometimes take place, and also the fact that it may take longer for healthcare workers in dealing with those folks, so they may just think it's more valuable to spend their time with other people if they're in a high, fast-paced environment and they don't have the time. They just think sometimes it's just best to go somewhere else.
I do think it's been fascinating for me to compare and contrast Canadian healthcare during this time to American. And it's different like throughout Canada. My parents are in New Brunswick. I have friends in Nova Scotia and Newfoundland, and they're all at different stages. But the biggest thing is that they're very behind in vaccinations, and they don't have the quantity that they need. So people are getting one dose and being told to wait 14 weeks. Until they get their second dose. And there is obviously a lot of pandemic fatigue going on, just like there is here. And so it's spreading again there, basically, because the vaccinations, the timing has not been good.
Well, Aaron has gotten a couple of questions from the attendees, and I think he's got a couple of questions of his own. I also want to throw it open to you guys if you have any questions of each other. But I'm gonna just step back and listen for a minute and hear what you all have to say.
Sure. So first, Dr. Fox, my family is binational. My wife is from Quebec, and so we're experiencing that same closed border, but a little to the left, and yeah, it's really hard. So just wanted to share that as well. We had a question that I think is for all of you probably. What are the most difficult adjustments you've had to make in patient care?
Sort of like what I mentioned before, the lack of ability to be physically close. We can with our patients. Again, so any of our inpatients who are at the Gosnell House have either recovered from and are out of quarantine from COVID, or have been tested negative before they've transitioned into us from the hospital. We're not testing people when they come in from their homes. So I can be with the patients, but a huge part of what I do is with the patients' families, and that loss of body language and the loss of being able to actually be close with somebody in a room, or be with everybody who needs to be there. That's been the hardest thing for me in regards to the day-to-day patient care. It's just that loss of closeness and ability to have access to that other information other than just the verbal that they're telling me.
I mean, for me, going into a room with a mask on is a big difference. I wear one of the N95, so this whole part is covered. And so many people say, I don't know what you look like. And I, meeting a lot of new people every day, so I have to ask them to go to my website. And just sometimes when a patient's nervous, being able to smile at them and, show you're there for them and care about their experience, it can really make a difference in people's view of how the dentist is treating them. And so, not to mention, like you were saying, reading lips for our patients who are hard of hearing. We have a few masks that are clear, but it gets to be a point of like the seal. We need a certain amount of seal. And so There are definitely challenges. I would say the biggest thing is not being able to take the mask off ever for me is definitely a challenge.
Thank you. So I'm going to insert one of mine in order here. So as an information professional and a health and science librarian, I know where I've been getting information throughout the pandemic, and I know where, unfortunately, a lot of the public has been getting their information during the pandemic. And I wondered if any of you could comment on the experience of sort of the evolving medical knowledge and how little we all knew. I assume you all also last February and March and April, and kind of how confident you were, like as we all got new information, or as you were getting information that might have been different from what the public was getting. But just on that process of learning about COVID from your perspectives as health professionals.
I felt really fortunate for all of my education, not just the things that I knew, but a large part of graduate school is not learning stuff, but learning how to think, learning how to look at information, how to sort it, how to filter it, and how to apply it. And so I felt really fortunate that I had that skill set. And, as we learned more, I felt like the information that was available, from the CDC, their guidelines were great, but I was able to look at the studies and read them myself and understand where those numbers were coming from. And the top line numbers all mean one thing, but the underlying data is actually where that rich source of, information that helps you form a good opinion comes from. So, I felt really lucky to have access to that skill set. And, here in this country, if you want to find that information, the studies, it's open, it's out there, like you can get it. So I think that's how I tried to follow it. I tried not to hinge on, too much that was coming out of the news necessarily, but use that to sort of direct me to try to figure out, is this real? Is this not? How does this affect, because I had a lot of patients' families, never mind the staff that I work with, but a lot of patients and their families asking me these same questions. And I'm sure everybody else here did as well. And you don't want to give people answers based on your opinion or misunderstanding. And I took that very seriously. So if I was saying something to someone, it was with the confidence that as best I could understand the data and the information was out there. It was true, and my interpretation was done in a way that they would hopefully understand, but still adhere to the facts of the situation.
I'd like to, even though I'm not a medical professional, I'd like to answer that question, because I spent that whole month of March in New York in an emergency room with emergency doctors. And that was before COVID. COVID was early in New York. It hit Boston a couple of weeks after that, didn't get up here that in March. And in March, what we saw in that emergency room was incredibly dedicated improvisation, yet at the same time panic and chaos that things weren't working. And literally every couple of days things changed. And you got, everybody knows about the different medicines, some of which were seen as, miracle cures, and then went to be totally discredited. The lack of ventilators, and I'll just say two things that I saw that I thought were really fascinating. And they both have to do with how COVID was viewed by the doctors I was with. Early on, one of them said to me, "We're treating this like a bad case of influenza," and that had a whole bunch of modalities that weren't working. And later on, they started seeing it more as something like high altitude pulmonary edema, the kind of stuff you would see someone up on Mount Everest, blood clots in the lungs, things like that. And one of the doctors said, "We treated this like influenza or pneumonia because this is what it looked like to us." And I was in the hospital at a moment when a gentleman came in, and he had a blood oxygen level of 70%. So he was in deep, deep trouble, really deep trouble. And I had asked to see a intubation, a ventilation, and they were about to ventilate him. And yet this man was talking, which you're not supposed to be able to do when you're not getting any air. And one of the doctors said, "Let's not intubate him. Let's prone him." And proning means you just turn a patient onto their stomach or onto their side, and you create more, and the medical guys, and you correct me if I'm wrong, but you create more ability for air to get into their lungs and into their bodies. And so this was a big guy. He weighed over 300 pounds. It took about 4 doctors and nurses to get him rolled over. And within minutes of him rolling over, his blood oxygen was up to 90. And one of the docs turned to me and he was shaken because they had seen people die on ventilators hours before and days before. And he said, I am never intubating another patient again for COVID-19. Of course, that was a little exaggeration. Sometimes you had to, but it was an amazing triumph of old-fashioned medicine, of observational medicine, and maybe it was a little bit of an indictment of sort of the by the numbers medicine, even evidence-based medicine that we use now, because there was no evidence for how to look at COVID-19 because it was unprecedented. And so there was so much learning and everyone did their best, yet the best was not good enough, especially in those early days, to save many, many lives.
For us in the dental field, when they did shut us down, many of us agreed, like, yeah, we'll take a time out because the aerosol generation that we create is so obvious. But it was when the ADA, the American Dental Association, started to make a little bit of a push for us to be able to do even a little bit of dentistry at least, that I started to feel like that was the right thing to do and started to get on board with that. But it was certainly a confusing time for a lot of dentists when the CDC was saying one thing and the American Dental Association was saying something entirely different. But it was also, it was worldwide. So it was very cool to see other dentists on Facebook. I'm in a lot of Facebook groups that have dentists from around the world. And I don't know if any of you got to see that some of the dentists in France were posting pictures of themselves in the nude in their operatories to represent that they had been left naked with no protective equipment. So there was a lot of different approaches that dentists took to try to get some attention that, we do fight to be considered part of the healthcare system. A lot of people are well educated and they know that the mouth is part of the body, but you'd be surprised how many people still view it as a separate entity.
Dr. Fox, I think it was true for a long time, and maybe it's still true that at least in Maine, or maybe it was nationwide, that there were basically no cases known to have originated with or passed inside of dental offices.
Correct.
Is that
correct? And that is still the case to my knowledge, that there hasn't been any transmission. It was during the AIDS epidemic that dentistry took their infection control to the next level. And I really feel that we are experts in the area. It's super important.
So we have another question, which is, what's the most important thing you would like to convey to people about their healthcare during the pandemic? And again, I think that's for any of you who care to answer.
Well, I think Dr. Fox really is just the perfect person to seeing the results of people delaying care. And I would imagine that is true across the board. I imagine our PCP, colleagues are seeing the same thing. You hear about this data. You see a drop in heart attacks and a drop in people presenting to ERs for strokes. Well, they're not having them. They're just not going into the hospital for them. Again, I live in a very niche world where we have been able to kind of continue what we're doing only because we were felt to be unable to stop. But to sort of reflect, I think, Munib, you said this earlier, Maine is actually pretty good about having resources, healthcare available to people. And when you're talking about hospice care, I think most people don't realize that everybody is eligible for hospice care, especially if you're talking about, us, where I work, we take anybody irrespective of coverage, it doesn't matter. But people don't know necessarily what their resources are. And I think that's probably been an even more clouded issue during the pandemic, where even I, as somebody who feels very comfortable navigating the system, I can't always figure out who can I refer to, who can I reach out to, who's available. And the information seems very scattered and not well presented sometimes. And I try to imagine somebody who's in the middle of a panic, maybe they're going to bed at night thinking, I think this might be cancer, or they're having horrible pain, oral pain, and they put it off by the time they see you. Turns out it's metastatic disease of some kind, where if you caught it sooner, maybe there was treatment. So I think people need to stay on top of it and realize that their providers in the community are still working, they're still out there, and it's just a little different, and make sure they reach out for the help they need.
Can I ask you, you are in hospice care, you have this ability almost to manage the end of life. And in COVID, we saw very rapid end of life, the opposite of that, unmanageable end of life. Is there anything that, as a hospice professional, that you could recommend to the medical profession in terms of helping people cope with death when it's happening so quickly and so chaotically?
Yeah, I think, so there's kind of there's a couple of pillars that are really absolutely essential for helping somebody transition through and experience death. Primarily, really, you want to think about good symptom management, and the discomfort associated with dying from an acute respiratory failure it's just horrible. It's horrible, but it is manageable. The symptom burden is indeed manageable. And so other healthcare providers, I think, maybe who feel overwhelmed, who feel like maybe there's not enough time, that kind of care is appropriate right up until the moment that you die. So there's never too late to think about being more aggressive with the palliative approach to the symptom burden that you're having. And then I think it's important to understand that even right up until the moment they die, connecting families with hospice services is not just about help for the patients themselves, but the emotional, spiritual, psychosocial support that occurs around, before death, around death, and after. The bereavement services that hospice provides to patients over a year out for their families for those deaths. We can connect you. We have admitted patients onto hospice services hours before they've died. And honestly, the clinical sort of interaction that I had for them was probably minimally helpful. But we've heard from those families a year out that support around that death has been really helpful. And so COVID deaths, any other sort of acute dying process, there's always time and there's always a positive impact that good end of life care can bring to that patient and the whole family system. And I think, that has gone by the wayside with some COVID patients where they physically couldn't be moved because they couldn't get out of quarantine. And we can do some of this. We can bring some of this hospice care to an inpatient setting in a hospital, a lockdown nursing home, but it's not the same as that sort of just real easy interaction that we usually would have. So we've had to adapt. We've done okay, but we're still not satisfied with what we're able to do.
Thank you. Munib, for you, you went through this intense trial by fire, and now you're presumably you're back at school. Things are sort of back to normal. I mean, how does it feel to be back at school after this experience? And what how has the experience shaped your vision of what you're going to do as a healthcare professional in the future?
Our school actually was fortunate enough to still continue in person, just not the first semester, because I was in school during the summer as well. That summer we didn't have in person, but in the fall and the spring we've had in-person classes. Fortunately, some classes were online, but not the majority. I'd say what has been impacted though is my clinical experiences, and that is what I was lacking and sometimes am lacking, but I'm trying to do the best I can, because I can't complain about what I can't do, but I can only try to see what I can do. And what I can do is try to do the best with what's offered to me. And this opportunity allowed me to kind of gain a better insight of some of the nursing home setting. I have only had 3 clinical experiences in the hospital last semester, and then this semester I've only had 3 other clinical experiences. I graduated in August, and I've only had 6 total clinicals. And fortunately, this summer I'll be having many more experiences in the hospital with my preceptorship and clinicals. But it impacted me as a student that is trying to learn, that wants to help, but it almost feels as though I can't help. So the ability to me to go to the nursing home and gain insight and to learn to be the best that I can be, I was grateful for that. So yeah.
Thank you. I have one more question for Joanna. You know, it occurs to me that both Jason and Munib are dealing with, you know, probably older patients, adults. You do pediatric dentistry as well. How did kids, you know, sort of cope with this when they were sitting in your chair? How did you reassure them, and you know, did the subject of COVID come up?
You know, not too often. It's surprising, actually. A lot of our kids turn out to be some of our best patients. So they're usually really cooperative. And yeah, they've been, you know, I was initially very concerned that they would refuse to wear masks, but our kids have been, like I say, you know, following the rules to a T. I just wanted to chime in a little bit from before. You know, if patients are wondering what they can do for their oral health, it is never too late to call your dentist or get a new dentist. You know, a cleaning can go a long way, and just really ask questions if you're scared. If it's fear that's keeping you back, call your dentist or a new dentist office and ask questions, because a lot of us are working above and beyond to make a safe environment, and it's never too late. And we're always happy to see you whenever you arrive and give you a nice fresh start.
Well, we have one more comment that came in rather than a question, which was, it says, this is not really a question, but thank you to all of you for all that you have done and continue to do to care for our community. We are stronger because of you. And I'll echo that. And I think that Dan has a final question for all of you.
Yeah,
Go ahead.
this is the big wrap-up question. I mean, you know, we've sort of danced around it a little bit, or maybe even directly addressed it. But what's the future like for you guys? I mean, what do you see in terms of the coming pandemics? What you've learned? You know, what is your big takeaway here, if there is one? And I know it's sometimes rude to ask people for a big takeaway because life doesn't always provide one. But if you got one, here's your chance to let everyone know.
I learned that I need a bigger facility. I'm going to need some more operatories. Just growing way faster than I expected, which is a blessing. So I can't complain.
I think this whole thing is actually, if we want to take a look at some of the positives, has unmasked some of the inefficiencies of how we were doing our work. And not just inefficiencies, but where those efficiency gains actually also brought a lot of benefit to our patients and to what we do. You know, sort of allowed us to learn that we can do a lot of these things remotely. And not because it's cheaper or easier, but it actually allows me to be in more places, not at once, but more places in a day. It allows me to do many more things, you know, not just the patient care, but, you know, my education of staff and stuff. I can do all of that in a way that's actually more beneficial. I think on a personal note, what I've learned is that if I didn't believe in how much I need to be around my patients and my families physically, if I didn't believe that before, I believe it now. And I'll never doubt again that that's such a huge part of what I do and why I keep doing it, why it's so important to me. So kind of a business and a personal takeaway for me.
I'd say the biggest takeaway for me was the grief that was on my patients' faces and the isolation that affected those older adults. I remember one resident actually cried, and to see tears in her eyes when I was leaving was kind of devastating, because I always try to put a smile on my patients' faces, and to see that was just reassuring on to maintain and to always remain myself and to not change for anyone and to always put a smile on other people's faces in this short world that we live in.
Thank you, Munib. That's a really apt wrap up, and I'm going to hand it back to Aaron. But I want to say thank you to all of you guys for the work you've done and for participating, and for you know, helping to keep Portland and Maine and everybody healthy. Thank you so much. Thank you, Aaron, and the Portland Public Library.
And I'll echo that right back to you, Dan, and Munib and Jason and Joanna, Dr. Fox. Thank you so much for participating, and thanks to the attendees, who again, I'll remind to have a look, portlandlibrary.com and Portland Public Library on Facebook. We hope we'll see you again at another program soon. And thanks to everyone, and have a great night.